Many patients come to me and ask, Doctor, what are my chances of having twins through IVF? It's a valid question, and the answer is more complex than most people think. Yes, there used to be a time when twin pregnancies were quite common with IVF. But that wasn't because IVF magically increases your chances of having twins. The real reason? Doctors were transferring multiple embryos at once. Why would they do that? Well, the more embryos you transfer, the higher the chance that at least one will implant and result in a pregnancy. In fact, transferring 2 or even 3 embryos might increase the odds of success. But this comes at a cost, a high cost. When you put in too many embryos, you dramatically increase the risk of a twin or even a triplet pregnancy. And while that might sound exciting to some couples who want double the joy, the reality is far more dangerous. Twin pregnancies carry a significantly higher risk of complications, miscarriage, preterm delivery, low birth weight, NICU admissions, and long-term health problems. Higher risk of complications, miscarriage, preterm delivery, low birth weight, NICU admissions, and long-term health. And these risks aren't just for the babies, they're for the mother too. Unfortunately, some doctors still follow this outdated and irresponsible approach. Their goal is to get you pregnant quickly so they can boast about their success rates. They'll say, hey, I got you pregnant, and with twins. But they won't be the ones managing the preterm labor, or watching your babies in the NICU struggling to breathe. That's why good IVF clinics around the world now recommend what's called single embryo transfer, especially when the embryos are of good quality. They focus on safety and long-term outcomes, not short-term numbers. Here's the truth, the only way to get twins in IVF is by transferring more than one embryo. But just because you can doesn't mean you should. Our advice? Have as many babies as you like, but one at a time. That's what your uterus was designed for. It's safer for you, and safer for your baby. So if you are considering IVF and dreaming of twins, take a step back. Ask your doctor the right questions. And make sure your treatment is guided by science, not just hope.